Hi, my name's Chelsea Gillis, and I'm an assistant professor in the School of Human Nutrition.
And my name is Poppy Caspis, and I'm a registered dietitian researcher at the McGill University Health Center.
Did you know that the stress the body experiences with surgery is similar to the stress of vigorous exercise?
Both make your heart and lungs work hard.
You would never run a marathon without preparing.
But people have surgery all of the time without preparing their body for the stress.
Our aim is to study interventions that help patients recover well from cancer treatments like surgery. Good food gives people energy to exercise well, so that can strengthen their heart and lungs.
And good food provides the nutrients to build muscles, both of which is important to prepare the body to withstand a stressful event.
Cancer treatments like chemotherapy or surgery are physically stressful for the body. Let's take a moment to talk about the stress of surgery. The body doesn't know that the cut the surgeon makes is for a good reason. All the body knows is that it needs to heal this new wound. To do so, protein from muscle tissue is broken down to provide the protein needed to heal that wound. The problem with that is that we don't have this storage of protein waiting around to be used for other reasons. All of the protein found in your body, like in your muscles, is serving this functional purpose. So when you lose protein, you can lose function.
And chemotherapy is kind of hard on the body too, because as chemotherapy kills cancer cells, it kills other cells in the body as well, including muscle cells. So we tend to lose muscle. And if we don't eat well because we're feeling sick from the treatment and we don't exercise because we're really tired from getting chemotherapy, we further the loss of muscle, and it just gets us into this downward spiral of not eating well, not moving, and losing more muscle. And the more muscle we lose during chemotherapy, the worse tolerance we have to these treatments.
So what we're trying to do with our research is help patients to strengthen their heart and lungs, help patients to build muscle before these treatments, before surgery, before chemotherapy.
And this is called rehabilitation. And it's important to build up these muscles before the treatments because we'll lose them during the treatments. So when we do lose them, it won't be as big of a deal because we've built them higher than we were at the beginning.
It's probably not a surprise then that eating enough protein is important to maintain that muscle mass and to maintain that muscle function.
So protein is found in food and in our body, like in our muscles, and is made up of building blocks called amino acids. So different protein foods are made up of a different type of string of amino acids. So leucine is a specific amino acid that's really important.
So this amino acid is a signal to the body to build protein. Where can you find this amino acid? It's found in protein-rich foods that are animal-based foods. So especially milk and milk proteins are really high in leucine.
Leucine is also found in plant proteins, but in a smaller quantity.
So if you aim to eat around 20 to 35 grams of protein at every meal, you're likely to be eating enough protein and the right amino acids to prevent that muscle loss. And what does that look like? We have these little examples for you. This is about 20 to 35 grams of protein and fish and chicken. So it's about the size of your palm or the size of a deck of cards.
Yeah. You could also get the protein, as mentioned, from plant proteins. We just have to eat a lot more of those plant proteins. So if we want to eat tofu, we'd have to eat about 1.5 cups or 2 cups of kidney beans. And it's really important to note that you can't eat all of this protein in one sitting, that you really need to meter it out throughout the day.
And in our experience, it's the meal that is most difficult for people.
Breakfast.
We recommend that you aim to eat about 2 to 3 protein-rich foods at breakfast.
So this could be 2 hard-boiled eggs and a cup of yogurt, or toast with ricotta cheese and smoked salmon.
An egg white omelet with cheese. So the important thing is when you're eating breakfast, count how many foods that you have that are protein-rich. Do you have 2 or 3?
A lunch and dinner, 1 animal protein is usually sufficient because we're just eating a little bit more, or 2 big handfuls of plant proteins.
The other thing that we recommend for our patients is to eat enough of those healthy omega-3 fats. These fats are really helpful to reduce that stress and inflammation in your body.
And you can meet your needs for omega-3 fats by eating fatty fish like salmon or mackerel.
And you can even take omega-3 supplements, but we recommend that you talk to your doctor or dietitian first to make sure that those supplements are okay for you to take.
Especially if you're undergoing chemotherapy.
My name is Jeremy Capone. I am the wellness chef for the Cancer Rehabilitation and Survivorship program at the Princess Margaret Cancer Center. So we do see a lot of patients that ask us, what are some ways in which I can make cooking a little bit easier? I'm dealing with fatigue, and it's a big barrier to, cook and cook healthy meals at home. So some of the suggestions that we do offer and cover in our classes are, one, to use some convenient products. So things like frozen fruits and vegetables. It's already washed, it's already chopped, it's already prepped, easy to use. Even like canned products, which are really easily available and usually budget friendly, and can make quick meals, are a great option as well. And then some assistive tools to help with that prep. So if the prep is a barrier, standing at the counter for a long amount of time is sort of draining, using a food processor to help do a lot of that food chopping can be really, really helpful. Some great tips for more of a practical approach to cooking, especially during and after treatment, would be, don't be afraid to use convenient products. Not everything has to be made from scratch. I think that could be a big deterrent, a big barrier for a lot of people. You can still eat well, even if you use like a pre-made chicken, right? And incorporate that into some dishes, or some canned and frozen items where a lot of that work is already done for you, and you might just have to put it together in a pot. So convenience can be your friend for sure, and it can still be a great way to get some good nutrition and some good meals.
The question is, when would you need to consult with the registered dietitian? We've given you a lot of tips right now, but what are some signs and signals that you would really need to consult with someone like us?
What you need to look for, two big things. Have you lost weight without trying? And are you eating less than you would normally eat? And this could be for reasons like you have a poor appetite or you're feeling nauseated.
So as soon as you're eating a little bit less than normal, or as soon as you feel you're losing a little bit of weight, it's very important to consult a dietitian, because she'll be able to give you tips on how to manage some of the side effects of treatment, including nausea, vomiting, constipation, taste changes that occur with chemotherapy, and will be able to advise you about what are the most nutritious types of foods that you should try to favor during chemotherapy. So some of the common questions I get in my practice is, do I eat the same way as I've always eaten when I have cancer and I'm undergoing treatment? And the answer is not quite. We need to adjust certain things, especially if we're lacking appetite and we're not eating as much. Sometimes the variety in diet will decrease significantly because we don't tolerate foods that we once really loved. And sometimes those foods, unfortunately, are very healthy foods. And then once it's all over, there's still a role for dietitians to play in the care of survivors. Survivors are often left with some side effects of the treatment that last a lot longer than we would hope. So getting back to a normal dietary pattern, getting back to that Canada's Food Guide, making sure that our weight is optimal and that our muscle mass is optimal, sometimes requires the help of a dietitian.
We have our own resource to find some great recipes and nutrition tips. So our website, elixirkitchen.ca, where our dietitian, Daniela Fiorini, and myself, we create lots of recipes. We have hundreds of recipes on there where you can find some great ideas. Also how to navigate some of the different side effects. We do have recipes that are categorized by some of the different side effects. And then our YouTube channel as well, where you can search us, Elixir Kitchen, on YouTube. We do offer a free monthly live class on our YouTube channel with, again, some great recipe ideas and nutrition tips.